Hi, everybody. My name is Deepali Kumar, and I'm a transplant infectious disease specialist at the University Health Network Transplant Program. Many of you have called in asking whether you should receive the COVID vaccine. I want to talk to you about what you should be aware of about COVID vaccines so that you can make an informed decision about whether to get the vaccine. The first thing to be aware of is that COVID-19 can be a serious disease if you've had an organ transplant. If you're diagnosed with COVID, you need to communicate that to your transplant provider to see if you're eligible for any treatments or if your anti-rejection medication needs to be adjusted. The best way to prevent contracting COVID is physical distancing, avoiding crowds, masking, and frequent hand washing. It's also very important for those around you to practice these prevention measures so that they don't bring home the virus. Now, what vaccines are available in Canada, and can transplant recipients get them? In Canada and the United States, we now have 2 vaccines for the prevention of COVID. They're both approved by Health Canada and the FDA. Both vaccines are very similar, but made by 2 different companies, Pfizer and Moderna. Both vaccines have undergone large clinical trials. The Pfizer vaccine study had 40,000 participants. Half of them got the vaccine. The vaccine was shown to be 95% effective in preventing COVID. The Moderna vaccine study had 30,000 participants. Half of them got the vaccine. This vaccine was shown to be 94% effective in preventing COVID, almost the same as the Pfizer vaccine. For both vaccines, most of the side effects were local, like pain and swelling at the injection site. But some people did feel tired, headachy, and had a low-grade fever. These effects are common with many vaccines and last anywhere from 1 to 3 days. Both vaccines are not live vaccines, so transplant recipients can get them. In fact, the Canadian Society of Transplantation and the American Society of Transplantation have endorsed that transplant recipients can get the vaccine. Now, will the vaccine work if you're taking anti-rejection medications? It's important to note that transplant recipients were not included in the Pfizer and Moderna trials. So we don't have exact information on how well those vaccines would work if you were taking anti-rejection medications. A good immune system is needed to make an immune response and protection after the vaccine. So it's quite possible that with a transplant, COVID vaccine effectiveness will be less than 95%. But it's also very likely that you're going to get partial protection from the vaccine. To make the most out of vaccination, it's best to time the vaccine properly. So for example, you shouldn't get the vaccine in the first month after your transplant or in the first month after being treated for rejection. Speak to your transplant doctor about the best timing for you to get the vaccine. What about side effects from the vaccine? From what we know about the way the vaccine works, there's no reason to believe that someone with a transplant would have different side effects than someone without a transplant. Could the vaccine affect your transplanted organ? Again, that's very unlikely. From what we know about other vaccines, like the pneumonia vaccine or the flu shot that many transplant recipients get every year, there has not been any impact on the transplanted organ. On the other hand, one thing we know for sure is that getting COVID itself can damage the organ transplant. There are some other considerations. For example, if you're a healthcare worker or an essential worker where you can't avoid contact with others, The benefit of vaccine is greater than any theoretical risk. In the same way, if you're in an older age group, such as 65 plus, or have other medical issues like high blood pressure or diabetes, you may wish to get the vaccine. If you belong to a minority group that is very affected by COVID, it might also be worth getting vaccinated. So remember that COVID can be a serious disease, and one way to prevent it is to get vaccinated. I hope that this has helped you make an informed decision about getting the COVID vaccine. If you have questions, talk to your transplant doctor or coordinator. Thanks for listening.